Hi, everyone, and welcome to the show. I'm Dr. Nicole, and today we're going to talk about integrative psychiatry. It's the practice of using complementary and natural treatment approaches alongside medical approaches for addressing symptoms in children and adults. If your child is on medications or you're working with a psychiatrist in some way, this information is going to be very useful to you. And if you're a parent who has maybe been recommended for you to see a psychiatrist for your child, you will also really benefit from having the information that we're going to talk about today. You know, it's a challenge. There aren't many psychiatrists practicing in this way, but the number is growing, and there are so many benefits to families who are able to seek out physicians who can use these combined approaches. So on the show today, I have my friend and colleague, Dr. Hyla Cass, here to talk with us about how she practices as an integrative psychiatrist, the kind of approaches she finds helpful, and specifically how she's been incorporating certain types of nutrients and supplements, including CBD with patients. So let me tell you a little bit more about her. She is a physician, psychiatrist, and frequently quoted expert on natural approaches to mental and physical health. She combines the best of leading-edge natural medicine with modern science in her clinical practice, writings, nationwide media appearances, on print, TV, radio, podcast, summits, the whole deal. She helps individuals withdraw from psychiatric medications and substances of abuse, or helps them avoid medication altogether through the use of targeted nutritional supplements. She's created a unique, high-quality line of supplements, including CBD hemp oil extract. Dr. Cass is an advisory board member of the Journal of Cannabinoid Medicine and the author of several popular books, including 8 Weeks to Vibrant Health, Supplement Your Prescription, Natural Highs, The Amazing Itty Bitty Guide to Cannabis, and The Addicted Brain and How to Break Free. It's such a pleasure to have you on the show today. Welcome, Dr. Cass.
I'm so happy to be here. Thank you so much for inviting me.
I've been really looking forward to this conversation because this issue of finding practitioners, particularly people who specialize in the field of psychiatry, who can best guide parents and kids on their journey with these kinds of symptoms, it's a big issue, and it's a challenge to find people who really understand how to combine these treatments. So I really have been just excited to have this conversation. I'd like to start out by having you share a bit about your background and actually what led you on this path towards practicing psychiatry in a more integrative or complementary type of way.
Interesting question. First of all, I always wanted to be a doctor. My dad was a doctor, and I thought that was very important. Well, the kind of work he did, healing people, was just amazing to me, and he practiced at home, so I got to see what people looked like before and after. So that was one part. He was quite an inspiration to me. Then I ended up going to medical school and became interested in psychiatry because I really want to know how people tick. What makes us be the way they are, the way we are, how we behave the way we are, and so on. And then in psychiatry, I was trained actually in psychodynamic therapy more than medication. So I wasn't, and I'll have to say brainwashed, because I say current physicians in training are learning that drugs are the only way. Well, we learned about psychotherapy.
Yeah. And
somewhere in there, I actually began to look at diet and nutrition. Pretty unusual, but there were some leaders out there. And looking at supplements as well, people like Carl Pfeiffer, Abram Hoffer, and they were my early inspirations. And what I noticed was that when people were on medication, and when I trained, and when I was in residency and in my early practice, we didn't have the vast array of medications that we have now. And they had a lot of side effects. Yeah. And they weren't that effective. And I look at this and say, what's wrong with this picture? And I beginning to look at blood sugar. And how blood sugar imbalances actually fostered mood swings. And people would get highly anxious, they get depressed, all kinds of things just because of their blood sugar balance. And by learning the right way to eat, the right foods to eat, the right nutrients to take, lo and behold, they no longer had their mood issues. So that's powerful. They didn't need a drug. And more, I was seeing people come to me who were on a load of drugs, all interacting with each other, not giving the end result that the person wanted, where the doctor would keep raising the doses, adding new ones, changing them. And you just have to use your powers of observation. Now, look, maybe the ones that were doing really well weren't the ones that came to me.
Mm-hmm.
I don't know, but reading what I'm reading out there, there is a lot of disillusionment about medication.
Mm-hmm.
It's not it doesn't really keep the promise.
Mm-hmm.
And the truth is that we are biochemical. We're mind, body, spirit, and biochemistry.
Mm-hmm.
And if we can make the biochemistry work for us, we have it all built in. We have the best natural pharmacy inside us. And I see the job of a physician is to mobilize that inner pharmacy and make it work for the individual in a way that's natural. So they're not going to have side effects, not going to have adverse effects. You're going to have a targeted effect, and that's predictable because you know what you're doing. You're really enrolling that person's physiology and biochemistry.
I love that term, that inner pharmacy, mobilizing that biochemistry within the individual to really function optimally. That's really just a great way of thinking about that. And, it's interesting, you were talking about in your training, there's been such a shift in the field of psychiatry over the last, few decades, from how psychiatrists were trained and what you're talking about, more of the psychodynamic therapies, those kinds of things, to now really psychiatry, most people's experience with psychiatrists is just about receiving prescriptions, right?
Yes.
Yeah.
Absolutely.
And I think that what you're saying about the disillusionment of that is so true, because the patients that I see in my practice and, the people that I'm interacting with in my online community, many of these children, many of these adults have been on what I call, the roller coaster of psychiatric medication, the hamster wheel of, psychiatrists and more, conventional, medical kinds of treatments, and they're not getting better. And in many ways, they're getting worse the more of these things that they take. And parents just go, we're doing everything we're told to do, but this isn't getting better. And it's such a frustration.
Yeah, and what happened was the pharmaceutical industry realized that they kind of used up the adult population as much. Many adults were using them as we're using them. They would keep developing new, the pharmaceutical industry was developing new ideas about, well, if you have this, then you need to be on an antidepressant or an antipsychotic, or if your antidepressant isn't working, take this antipsychotic. Mm-hmm. Right? Crazy. So that's how they were enhancing their market. But that got limited. So they began to lower the age of who they were addressing. Mm-hmm. So it began to be teens, and then children and infants. Mm-hmm. And it's horrifying. It is absolutely horrifying to take a young brain and put these very powerful medications that are, I'd say, quite toxic. Mm-hmm. And it's scary. And there's so much that we can do with diet, nutrition, with diagnosing various underlying, say, infections, mm-hmm. or so many imbalances that can cause heavy metals, mm-hmm. Chemical exposure. Mm-hmm. Kids that are exposed to lead, for example. Yeah. You need to chelate out the lead. They don't tell you about that. Right. They don't tell you that you can chelate out the lead. Mm-hmm. So in areas where there's lead in the water, mm-hmm. those children grow up slowed down mentally.
Right. Well, and here in Michigan, we've seen that with the Flint water crisis and in other areas too, where that's, not getting better. And you're right, no amount of Risperdal or other kinds of psychiatric drugs is going to solve those problems. We need to get in and deal with those underlying issues, right?
Yeah.
Yeah. So you've touched on you know, some of those things you mentioned as you were talking about your experience of, you know, moving towards an integrative approach. You talked about blood sugar, and you've, you know, mentioned some things about nutrition, talking about like getting rid of the heavy metals. What are some of the driving factors that you see are most common, whether we're talking about kids with, you know, emotional and behavioral challenges, we're talking about adults with these things? What are some of the things that you see are most prevalent that are not getting addressed for people that really are driving symptoms?
What do you mean specifically? I don't know exactly what you're.
Yeah, so, you know,
Doing.
if what are some of the things that you see when patients come into you and they're having, let's say, anxiety, depression, you know, kids with significant behavior challenges? What are some of the things you're looking at? What are some of the things?
What are the underlying conditions
Yeah,
you're saying? Oh,
yeah,
yeah, which I just mentioned actually.
yeah,
Various infections, viral
yeah,
infections, Lyme, bacterial infections, um, hormonal imbalance, low thyroid.
yeah.
Um, it's so many. You know, there's a whole checklist
Right.
that any good functional medicine doctor is going to look at and test for.
Mm-hmm.
And as I said, the chemicals, the heavy metals, so many things can interfere with proper brain and body function.
Mm-hmm. So is it a good idea for let's say for parents when they're being sent to see a psychiatrist, because that tends to be, I mean, sometimes it's a pediatrician or a primary healthcare provider initially, but, you know, pretty quickly kids, you know, get sent to a psychiatrist, especially if they're having, you know, more mood issues, behavioral acting out, you know, more severe ADHD, those kinds of things. Is it a good rule of thumb for parents when they're meeting with a psychiatrist or a healthcare provider to watch for what is that provider asking about and looking for? Am I being asked about these kinds of things? Because I think most people, they don't have any experience with providers asking about, you know, that kind of stuff. What is your child eating? You know, asking about possible infections or health issues or gut health or any of those things.
Yeah, unless you're really attending to the gut health and the diet of the child, you're not going to get anywhere. We know that.
Yeah.
So it really depends on who you go to. You know, 99% of psychiatrists are doing it the way we were just talking about. It's a prescription.
Yeah.
Period. The end. And in their mind, and in the mind of many people, how can nutrition, how can nutrients,
Mm-hmm.
how can an amino acid and some vitamins be more potent and more successful than a drug? Au contraire, it can be much more successful because it's working with the body's chemistry.
Right.
So you have to choose your practitioner.
Mm-hmm.
You have to go to someone, and you can. I do this for people, for help them find someone in their area.
Yeah.
And I can say, you just Google, you can look at functionalmedicine.org. I have a place on my website also where it says resources, and you can look at different organizations, naturopathic organizations. If you see an MD or an ND, naturopathic physician, and these are very well trained. It's a kind of medical school. It's different from allopathic medical school, but they learn a lot of the same things that we do as MDs, but they also learn a great deal about natural medicine, the use of herbs, the use of how to look at gut health, and how the gut and the brain are so connected.
Yeah, that's very helpful resources for people to find a practitioner, and just to raise people's awareness that people like you are out there, and it does take some seeking out, but that often you do need to go beyond whoever the first referral is that you get if you want to really look at these things, you know, in more depth. You just mentioned about the gut, and I want to talk about that because I think that, you know, is something that you and I talk about in our practices and with people all the time, but that a lot of people don't realize that connection between brain function, between behavior, emotions, you know, thinking, all of that, and the gut. As a psychiatrist, what do you find is so important about dealing with the gut?
Well, the gut is the source of a lot of our neurotransmitters. And in fact, the friendly bacteria in our gut help make a lot of the neurotransmitters. We have a nerve plexus in the gut. Our immune system resides, a large part of the immune system's in the gut. Very, very important. And we need to take care of it. And the opposite is true in that children are eating junk. They have what's called leaky gut. They have a lot of food allergies. We're actually pretty much in trouble. So the microbiome is not healthy. It's not helping to make good neurotransmitters, which appear to be transmitted actually via the vagus nerve, which goes, the longest nerve of the body goes from the gut to the brain. So all of that needs to be addressed. You're not going to get that from a regular psychiatrist. Don't expect it. And there's no point arguing with them or asking for something that they just don't know.
Right.
It's not their training. They're doing the best they can with the tools they have.
Right.
And unless they have the extra curiosity to look at, well, what is that happening? Let's look under the hood. Those are the people who go into the more functional or integrative medicine, like me.
Yeah.
I want to see what's really going on, what's contributing. And then we make interventions. We give specific nutrients. First of all, it's healing the gut. Well, these kinds of doctors that I'm telling you about, they're not psychiatrists. They don't have to be psychiatrists. You can have a child who's referred, your pediatrician says they should see a psychiatrist. Hopefully you're seeing a more holistically oriented pediatrician. You may not be. In which case you go to someone who is, as I said, an MD who's practicing natural medicine or integrative medicine, functional medicine, or an MD, and they will address the gut issues and infection and heavy metals and chemicals and all the things that can mess up one's brain function, mood, behavior. And it can make an enormous, enormous difference. Also just substituting, it is an interesting thing. I had a woman that she was a worker in a place that I was having my meetings at. And she told me that, and she knew I was a psychiatrist, she said her son had been told that he needed to see a psychiatrist to be evaluated for medication for ADD. And she was very much against it. So she asked me, what should she do? And I didn't know the child and I didn't know her. And so I said, something you can try is some fish oil and my Focus product, which has tyrosine and phenylalanine in it, which are precursors to dopamine. And dopamine is the neurotransmitter that is often insufficient in ADD. It's not the only thing, but it's very common. So she did that. And I supplied her with some Focus and some fish oil. And the next time I saw her, which was a month later, she reported back that the teacher was very pleased that she had actually, I'm very happy that you went to a psychiatrist and he got medicated because clearly he's doing so much better. And she didn't say anything. He didn't say anything. And that's the way it goes.
Yeah. I love that you shared that example because just so many stories that we hear from parents the same way. I had a parent email just last week saying, her child had been given a formal diagnosis of ADHD, although, those had been the symptoms all along. And she went to a school meeting and the first thing, the teacher and the principal said is, okay, well, now you have this diagnosis. So when are you starting him on medication? And she said, well, that's not my plan. We're going to continue with the integrative approaches that we're doing because, he's making progress and we're doing this. But that mindset that so many people have, particularly in the schools of, oh, okay, you have this label now or this symptom. So like, what's the prescription for it? And it's so frustrating to me as a practitioner. And it's so disheartening for parents too, to feel like they're just being so pressured that that's the only acceptable option, whereas we know there are so many other great things that they can do. And what's interesting is I've had that too, where I'll start a child on some supplements on an integrative plan to address symptoms like, ADHD or things like that, and they improve. And the school then says, oh, well, what medication do you have him on? He's doing so much better. And it's like, he's not on a medication. We cleaned up his diet. We're giving him fish oil. We're making sure that he's not overusing, screen time. Like these are the things we're doing and he's getting better. Yeah.
Oh, and the big thing, gluten and dairy.
Yeah.
I mean, that's simple. Maybe not so simple if you're the mom.
Right.
Getting your kid off it. But, give the child a few weeks off of gluten and dairy and see how they do, and that you can have miracles.
Right. Absolutely. Yeah. And these things don't have to take a tremendous amount of time to see the impact.
Right.
Yeah.
And then when they go back on it, then
Mm-hmm.
they become symptomatic again. One of the big problems is split families,
Yeah.
where one parent is, first of all, sometimes it's right in the home
Mm-hmm.
where the two parents are differing, and other times it's divorced parents, and that's a very difficult situation.
Yeah, absolutely.
And so you know about that. In fact, I'm trained in child and family, but I don't see kids anymore.
Right.
So, and in fact, also my practice is virtual.
Mm-hmm.
So I'm really limited. I don't like seeing children. I don't want to treat even teens long distance, because they haven't usually chosen to be seen.
Yeah.
And long distance is just too, it's just not adequate for kids.
Yeah, absolutely.
I think they be seen. There's things that parents can do on their own.
Yeah.
But if a child really is having enough problems that somebody thinks they need a referral, then they really should see someone in person, if at all possible.
Yeah, and those pieces of, an integrative treatment plan, the psychiatry, the integrative medicine piece is one piece, but you're also bringing up the components of family dynamics that need to be addressed. There's often many components of effectively, working with families around this issue for sure. I wanted to go back to, we were talking about the gut, the microbiome, those things, and how when you have, imbalances in the gut, leaky gut, those kinds of things, we can have lots of these brain symptoms. Also read, there's some studies that have come out now that I think supports what people like you and I have seen anecdotally as well, that a lot of the medications that these children and adults get put on for these problems also negatively impact the microbiome. And then we have this whole cyclical problem.
Yeah. Yeah. It's not just antibiotics at all. Many, many drugs do that. Mm-hmm. And if you don't have a functioning microbiome, you're in trouble, because there are actually some formulas that you can take that are specific to seeding the gut with certain friendly bacteria that will make specific neurotransmitters. It's coming down to that kind of specificity. Yeah. And the other thing is, you asked me about CBD. CBD is very good for healing the gut, healing the microbiome, and you end up with more positive messages from the gut to the brain. Mm-hmm. And the neurotransmitters begin to work better. CBD helps to regulate neurotransmitters. It's quite a remarkable product. It's part of the endocannabinoid system. Mm-hmm. We have an endocannabinoid system within us. That's like our own CBD that we make ourselves. Mm-hmm. Anandamide and 2AE, 2AG, I should say, because anandamide is 2AE. So there's these main two endocannabinoids that do this. They work on all throughout the body to regulate immunity, they regulate pain, they regulate neurotransmitters, and very, very significant. And along comes CBD, or actually it's full spectrum hemp oil. Mm-hmm. It's really hemp oil, because CBD isolate, which is just CBD, is not the whole plant. Mm-hmm. And as you know from herbal medicine, using the whole plant is really important.
Right.
So my product is called full spectrum hemp oil extract, because it has CBD in it, but it also has some of the other cannabinoids as well as the terpenes. And we also know that terpenes, which give plants their fragrance, mm-hmm. Tea tree oil or lavender or lemon, they all have their very unique flavor, which is also related to their healing benefit. Mm-hmm. So it's a very complex and beautiful arrangement. So CBD is quite a powerful plant-derived, hemp-derived mm-hmm. product that can be used in children. Mm-hmm. You do a smaller dose than an adult, but has a lot of impact on a lot of different systems, just because the endocannabinoid system is so ubiquitous in the body. And it's made for emergencies. It's made for stress. If we're in an accident, if we hit ourselves on something, cut, whatever, it goes into emergency mode, and you get the body starts to make more endocannabinoids that go to the place of the injury. and also calm you down so that you're not overly stressed by the incident. So it's a wonderful built-in de-stress component we really need to have. And some people, either genetically or through diet or through having excessive stress, have a low level of it. And these are the people that are more pain sensitive, that are more depressive, more anxious, may have migraines. All of these things are actually signs of a low endocannabinoid system. And there are ways of measuring it. We don't do it in the lab. Researchers have ways of doing it. Eventually, probably not in not too distant future, we'll be able to get levels, but we don't right now. But you can tell just clinically, you know, when all this, everything's going south, you are very likely low in endocannabinoids. And the best way to tell is take some CBD, start off really low, and just gradually build up and see what happens. And if people are surprised, I mean, I've had people sitting in front of me with tremendous anxiety, and I say, would you be willing? I remember this one young man was not happy to be there. A lot of kids, that's what I'm saying, a lot of teens are not happy to be brought in by their moms. So he felt very anxious, has trouble sleeping, and he was actually had been smoking a lot of weed. So I said, would you be willing to try some CBD? Yeah, okay. He's not very enthusiastic. So I gave him some under his tongue and said, hold it for 30 seconds. And then continued talking to his mom, and he was sort of slumped in his chair. And about 10 minutes later, I went, so how are you feeling? And he said, oh, and he kind of tuned in. He said, well, I really feel good. Wow, I haven't felt this good in a really long time. I'm feeling relaxed and much calmer. And here he was actually a weed casualty. Because when you have, particularly in young people, when you have the levels of THC that are in the products that people are smoking now, it's really high. It's really hard on the system. And it is totally out of proportion. In the plant, the original plant, there was a proportion of CBD, THC, and all the other cannabinoids. Because THC is a cannabinoid too, but the plant's been bred to be very high in THC, which for many individuals, it will just tip them over. And the antidote is actually treating them with CBD ongoing. And that will also cut down on their craving for the weed. Because they're craving the weed because of the anxiety, so it helps temporarily, but then it's also making them more anxious, particularly when it starts to wear off. So substituting CBD, or actually just adding it in. You can have people who are smoking, you add in the CBD, and they're gradually going to feel less of a need. And this happens. They stop smoking, and it's much easier for them to let go of their marijuana.
Yeah, I'm so glad you raised that, because it's something that, I'm seeing clinically more and more in teenagers and young adults, especially as marijuana is getting legalized. It's much more, accessible, but that same thing of I empathize and I understand why they are using it, especially if they tend to really struggle with high anxiety, with, things like that. But then the trade-off of that is reduced executive function, the addictive pieces, all of those things. And what you're talking about of being able to use CBD as a helpful antidote or a help to meeting the needs of their endocannabinoid system, helping balance their system so they can manage the stress, better, and not needing to use the marijuana. That's such an important thing for people to know, that option exists.
Oh, and what's more than that is it actually helps to release the THC from the synapse where it is. So it's not simply, well, it's relieving anxiety so they don't need weed. They're very intimately related. So the CBD will displace the THC in a good way, because it's giving much better anti-anxiety effect than the THC was. And they realize they feel better. And when you feel better, it's like, oh, okay, I'm going to do what makes me feel better. You know, and some of these kids are smoking because of peer pressure. They may not have been that anxious that they were using it, but the other kids are doing it, and well, it looks like fun, and we giggle, and we eat, and it's, you know, it's fun and games till it isn't.
Right. And that idea that it's a benign thing, that, oh, you know, nobody really has a problem with it, it doesn't cause issues. I mean, I see young adults in my practice who have been, you know, using marijuana for years that have pretty significant executive function problems in their frontal lobe as a result of that. And, you know, this idea that, oh, it's not going to harm you. Some people are really more sensitive to it, right? And it really can cause problems for some people.
Yeah.
Yeah.
Absolutely.
So as you're talking about the endocannabinoid system, it made me think back to the gut, you know, this idea that we need to be in balance, right? We need to have the right balance of things, you know, in our gut to be healthy and have our brain function well. Our endocannabinoid system needs to be well balanced, right? I mean, as you're talking about it, that's how I'm thinking. Like, some people's endocannabinoid systems are out of balance, or as you said, they're just so low, they're not allowing them to respond to the stressors and the things in life, and then they develop symptoms. Is that a helpful way to think about it, this idea of balancing that system?
Absolutely. Yeah. Yeah. We need to fill up the reservoir. If you are low in it, you're going to be more susceptible to everything. They did a study on people who were affected by 9/11. And those who had the worst PTSD compared to those who had no PTSD had a very big difference in their level. And this is where the researchers can measure endocannabinoids. So the ones who developed PTSD had really low endocannabinoid levels. The ones who were sort of immune to it, who managed to deal with it much better, did not. And in fact, it's also a treatment for PTSD. So in this research study, it was simply to measure, not to treat. So that was not part of the protocol, but the other part of the protocol could have been to treat those individuals, the ones with the low reservoir with the PTSD, and give them the hemp oil extract. And that would have been really very useful in helping to treat the PTSD. I think it also helps to do certain trauma therapies, which you're familiar with, and not the topic for discussion today. But if you use that, I always use biochemistry along with any other modalities, education, talk therapy, trauma therapy. It just makes it all go better.
Yeah, I totally agree. It just makes the person, it helps them be in a better space to take in and make use of all the other therapies that they're doing. You know, when you have the body in balance and working well, it's just such an important foundation for everything else.
Yeah, you're operating on all cylinders.
Yeah.
So you can take in the therapeutic concepts, and you can change your behavior. You have some control.
Right.
So very important, like in addiction treatment centers where they're giving medication to help people get off, well, they're off of their substances of abuse, alcohol, cocaine, meth, whatever, marijuana. So, and they're being given medication. That is not the answer, because that gives them a cloudy brain that isn't working very well. It's interfering with the microbiome, so they're not making their endocannabinoids there. So I see it as being counterproductive unless it's in the acute phase where it can be life-saving. That's a different story.
Sure.
But for example, with alcoholics, you have to treat them with medication at the beginning so they don't have seizures. But actually, I think CBD could do a really good job there, but that's not part of any protocols yet. So I'm not going to stick my neck out on that, but I think it's a very good adjunct. And CBD is a really good adjunct in treating addiction and helping people to restore a brain that they probably haven't had in years, if ever.
Yeah. Well, and I you know, you're talking about it in so many ways that it can be used to help people with, you know, very serious kinds of issues, addiction issues, coming off of medications, but even just for balancing, you know, normal stress and anxiety responses. And I'm thinking of all the parents listening. You know, we know that parents of kids who have developmental mental health challenges, any kinds of special needs, tend to be under a lot more stress. You use that term, you know, depleted reservoirs, that describes a lot of the parents, their resources, their internal resources are depleted. And so even thinking about, full spectrum hemp oil, the CBD, as being even a beneficial resource for parents who may not have any particular diagnosis or whatever, but just looking at ways to support their systems too.
Yes, absolutely.
Yeah. I want to have you touch on something that I think is an important part of this conversation, because we have come to an era where CBD, or things called CBD, are available in everywhere from gas stations to video stores to online. And I think there is a quality component of this discussion that's important, right? Like, all CBD products are not created equal. So could you talk about what people should look for to have a quality, effective CBD product that they might use for themselves or their kids? What are the things people should be looking at there?
Well, probably don't buy it at the gas station.
Yep.
There are very good brands around.
Yeah.
We have supplement companies that we all use that make good product because they have to. Everything is totally tested, and you want a product that's been tested.
Yeah.
That has where you can ask for a certificate of analysis, which means that someone the product was sent to a lab, and it was analyzed for what was in it, and it had all the right things in it, not the wrong things.
Yeah.
So that's pretty standard. And then taste is important. I was finding that tastes of most of them are pretty bad, kind of grassy and
Like
thick.
dirt, sort of.
Yeah, and for a lot of people, that was it's sort of a turnoff. They couldn't do it. So I actually developed one that's lighter. It's in a lighter oil. It's an MCT oil, and it has a light lemon flavor. Yeah. So that's more tolerable.
It actually tastes good. I mean, when I tried yours, I was like, oh, it's quite different. Yeah, a lot of them is, I guess in a nice way, we could describe a lot of them as earthy, right? Yeah. But the taste of yours and just even the texture of it, because yours is an oil, and there are ones in capsules or whatever. Is there a reason that you find that you like to use the oil? Do you recommend that more, as compared to like a capsule product?
Well, I actually supply both. The capsule takes longer to become effective, because that's go through your digestive system. You lose some of it through first pass through the liver, where some of it is broken down. But then what's left lasts longer. So I recommend people take that at night, so it'll help them to stay asleep. And they take a tincture, the oil. Tincture is really really an alcohol, so I don't know why they call CBD tinctures, but we do anyway. So you take the oil product, and that will work right away. As I mentioned with that young man I was seeing, it just like, there he was. He suddenly went from highly anxious to, oh, I'm feeling great. So use it at bedtime, and that'll bring you down, make you feel like bring you down from anxiety, calm you down, relax you, so that you can fall asleep. And then the capsule will sustain you throughout the night. Yeah. Hopefully, if you wake up, you can always take another drop of it.
A drop of it to work more quickly. Yeah, I think that's a helpful distinction for people to understand how the different formulas work. And, one of the things that I think you work on with people that is so valuable that most psychiatrists aren't, is how they help themselves wean off of or reduce their psychiatric medication use, because it's such a challenge for people. And I hear this from patients and from parents all the time. It's like, there isn't a lot of information out there, and not a lot of even medical practitioners who know how to help people with what can be sometimes a really tough journey of getting themselves off of medications that either aren't working well for them or are causing side effects, or they have found things that work better. What do you find are some helpful things to keep in mind for that? I mean, I assume like using nutrients, good principles of nutrition, gut health, all of those things are important in that process, right?
Right. And then depending on what the medication is, taking nutritional supplements that help support that particular system.
Right.
So if they're coming off an antidepressant, like an SSRI, I would give, say like 5-HTP, but also take that 6 hours away from the medication because of the kind of rare but risk of what's called Serotonin Syndrome, which is too much serotonin. Or if somebody's on a stimulant, you would make sure that you're supporting that's the dopamine system with, say, tyrosine. Or I have a product called Focus that has tyrosine and phenylalanine. But you could use plain tyrosine, and as well as the B vitamins, and a full complement of, have a good multi, because we need the cofactors to make those neurotransmitters. It's not just the amino acid, but it needs its helpers, the B vitamins, magnesium, zinc, and so on. And often, by the way, kids are low in zinc, especially when they've had a growth spurt at puberty. So very important to measure zinc levels and give zinc. So that's a topic for another time.
But I think it is helpful because some people really do struggle with coming off of these or weaning them or making changes to them, and there's not a lot of support out there. And so for parents to understand that there are very tangible, helpful things that can be done by using nutrition, both through food, but through targeted nutrient protocols that can really ease the way with that and help make that process easier. I think that's so important for people to understand.
Yeah, and then you wean slowly. I think the problem in the community is that when someone wants to go off the medication, I've had doctors say, I put people on medication, I don't take them off. And you're on it for life, and it's like insulin for a diabetic. To a child, I can't even, I can't go there. So you wean slowly. You say it's something like 10%, rule of thumb, about 10% every 2 weeks. There's different ways of doing that. Sometimes you need to go to a compounding pharmacy, or if it's a capsule, I have them mix it up with sterile water in a syringe, and then take a measured amount every day. I don't think you're going to do this at home. You need doctor supervision. You have to have a doc. Your own prescribing doc has to be willing to do this, which is unusual. And hopefully there are going to be more and more of them coming online. Because we desperately need more functional medicine or integrative psychiatrists.
Absolutely. We need more people like you who can help with navigating this, number one, in a way to really get to the root of things, but also to help with this process of coming off, because so many parents say to me, if I had known what the reality of this was going to be like back when we were handed that prescription, I never would have done it. But they don't know.
They don't tell you.
That's right.
And they don't tell you the misery. I can't even tell you the emails I get from people who've been put on benzodiazepines and were never told they were addictive. Never. And their lives are ruined. So, I try to help as much as I can with shoring up their system using some of the precursors, GABA enhancers, serotonin enhancers, essential fatty acids, and of course CBD. And just doing a very, very gradual, even like when you get to the last, like 1 milligram of Klonopin, you think, well, that's nothing, but it's terrible getting off it for many people. People can do it actually, but when they have low reservoirs of the precursors, then they're in trouble. So that's what I do, give them the precursors, take CBD, and then they can build up their system as they're reducing very, very gradually those tiny amount, by a very tiny amount of, say, benzo.
And I think it just gives hope to people out there who have really struggled with this, are struggling with this issue with their kids, to know that there are options, there are things to explore, there are practitioners who can help them do this. We've covered so many great and important things, and I really appreciate the conversation. I want to make sure that people know where they can get more information about you. You've got a great website, you've got great books, great things available, products. Where's the best place for people to find the things that you're providing?
I'd say just go to my website, cassmd.com. I also have a professional Facebook page.
Mhm.
So that's listed on my
Okay.
website. And so people can write their comments, and I post pretty regularly. And I invite people to go there. That's where I have my correspondence with people.
Yeah. And we'll make sure that all the links for those things are with the show notes, and your books are available on Amazon, I know, as well as other places too, right?
Yeah.
Yeah, and those are really great, just great additional resources that I highly encourage listeners to access, to just delve into different specific aspects of the kinds of things that we have covered today. I really appreciate you being here, spending the time with us. I know that this conversation was very valuable to our listeners, so thank you so much.
Oh, it was such a pleasure, Nicole. You're making such an important contribution with your work,
Thank you.
both in the office and with this podcast. So thank you.
Thank you. I appreciate that. And thanks to all of you for being here with us and listening. We'll catch you next week for our next episode of The Better Behavior Show.